Hello people, in this video we want to study Pagets disease of bone. This is a miscellaneous condition that you find in bones, okay? So basically it is also called as osteitis deformans. What is happening to the bone? It is getting deformed. Why? Look at this. The tibia, you can see the right tibia, how it is bent, right? It has become bowed. So this is because of Pagets disease of bone. Here what is happening is the bones bend, they get thickened and spongy. What happens to the bones? They are getting bent, thickened and spongy. Okay, so tibia is most affected. Otherwise, a lot of other bones also can be affected, like the pelvis, skull, femur, spine, etc. can get affected. Okay. Now here, what is the cause? They are not sure at all what the cause is. They are saying it could be virus, genetic, etc. or cause is not known. So humbly they are saying that cause is not known. But they are sure of one thing, there is some imbalance between the osteoclastic and the osteoblastic activity. This they are sure. So imbalance between what? Osteoclasts. Osteoclasts are what? Bad things. They are going to destroy the bone. What is osteoblast? They are going to form new bone. So there is some imbalance between these two things. That is the formation of new bone and destruction or resorption of bone. There is an imbalance. Okay. So there is increased bone turnover. There is irregular bone resorption. So now what is happening here? Because of all this, the bone is initially soft and vascular. Okay, in the initial stage it will be soft and vascular, but later it will become dense and hard. Okay, so this will all lead to what? This bowing of your leg like this. Okay, so in bowing of legs, you have also seen bow legs is another terminology that you see in vitamin D deficiency rickets, right? So there also you'll see something like bow legs. That will be something like this. See, the legs will be something like this. That will be bow legs, genu varum, right? Here the bone is bending, okay, nothing to do with genu and all. Anyways, here one more thing they're saying is, how will the bone be? There will be more osteoclast activity. There will be absence of Haversian system, they are saying. There will be sclerotic bone, yes, that's what they said, right? It will become dense and hard later. So it will become sclerotic. Then remodeling is poor and the quality of bone changes. So basically the quality of the bone changes. So basically there is a poor remodeling. The bone is not able to get its shape, right? That's what is happening here. Imbalance between the osteoclastic and osteoblastic activity, Pagets disease of bone, remember. Okay. Then what are the stages? There are some stages also. Initially it will be hypervascular, osteolytic. Obviously it is soft and vascular initially they said. Then what will happen? There's an intermediate stage. Finally it will burn out. How much can it keep doing all this? Finally there's a burn out stage, looks like. So these people are, after 40 years of age, they will come to you with a dull pain like this, and bowing and thickening of the affected bone. So they can also be susceptible to pathological fractures. They can have other systemic signs also, like neuritic pains. They can have arthritis, etc. They can have some systemic pains, skull, etc. The nerves are getting compressed, etc. All those things are there, but here we will focus more on the bone part of it. So when you do X-ray, what will you see? Lytic areas. You will see lytic areas, multiple confluent lytic areas with interspread new bone formation. So both are there. Lytic also is there, new bone formation also is there. So that is kind of a thing that they are telling you here. Okay, you can see the bend here. So then you will do bone scan. Bone scan, you are seeing here what is happening in bone scan. Bone scan, there is increased uptake. Okay, whenever there is bone formation and all, there will be increased uptake, I'm thinking. Alright, and serum alkaline phosphate is elevated. This is because of the osteoblastic activity itself. Osteoblastic activity only. Okay, so everything is osteoblastic here they are saying. But when you do histopath, you will see osteoclast, right? Clasts you will see, Haversian system will be absent, etc. Now, what are the complications of this? Basically, these people have deformity, right? Deformity they will have. They will have pathological fracture. Then they will have malignant change also can happen. Okay. So let's learn like this. They can have deformity. They can have pathological fracture. And they can have malignant change. It can become osteosarcoma. Okay, so these are the complications you can see. Now, how will you treat? So treatment, you will have to give calcitonin. Why will you give calcitonin? So that bone resorption will not happen, right? It will protect the bone. Bisphosphonates, same thing, to protect the bone from resorption. Then to decrease the increased osteoclastic activity, stop the osteoclastic activity, or you can say reduce the osteoclastic activity, you will give rice dronate. Okay, rice dronate. This calcitonin is the drug of choice, you should remember. Calcitonin is very important, okay? Then if there's any deformity like this, you will have to fix it, right? You know in orthopedics how to fix all this brace and all that they will give, right? So just you will have to fix the deformity, and then if there is a secondary osteosarcoma, because we told you there can be malignant change, you'll have to treat it, okay? So this is all about the Pagets disease of bone, osteitis deformans. In the exam, if they ask you osteitis deformans, please write this Pagets disease of bone, okay? That's it. Because of imbalance between the osteoclast and osteoblastic activity, there will be bowing of the long bone and deformity, etc. Okay, that's it guys. We'll meet you in the next video. Bye bye.